no public services will be open. All restaurants, bars, gyms, cafes, everything is closed. And it's a very, very difficult time. But one of the things which is probably slightly different to other countries of say Muslim majority is that in the United Kingdom, where we have about 3 million Muslims from a population of just over 60 million, what COVID has done is it's actually challenged some of the barriers between communities because the threat is so extreme. People are actually dependent on one another, helping each other out. So we've seen a wonderful blessing come with COVID, which has been many people have seen the way of Islam, the way of Muslims, in a very positive way. So reflecting on the personal hygiene of Muslims, which before was always seen a bit of a joke, that, like, for example, wudu, making wudu in public was always a bit like, what are these guys doing? Now, all you see people doing is washing their hands. And it makes it, well, when we were washing our hands 5 times a day, it was a joke. Now everybody's washing their hands. Then we had here the issue of niqab and the covering of the face. This was seen that this was intolerable, that this was something that was against civilized practice. And now everybody, when they are outside, they are covering their face. And lastly, we have seen the generosity of Muslims is being unmatched. It's unmatched. So we are seeing people within Muslim communities help people, Muslim, not Muslim, makes no difference, and show them that this is the way of Islam, and this is the mercy of the Prophet, that this is how we deal with people in times of difficulty. So we've seen many positives, even in amongst obviously the very difficult situation of over 10,000 people losing their lives, over 85,000 people infected. So yeah, it's a mixed situation.
Okay, thank you very much, Brother Azim Kidwai. Yeah, it's very interesting explanation that, of course, there's always wisdom and lesson behind all the tragedy. And Alhamdulillah, Dr. Saleh Alawaji has also joined us. Yeah, welcome to the talk, to the talk show, Dr. Saleh. And we just begin with our first question related with the current progress of coronavirus diseases or COVID-19 pandemic that takes place in more than 200 countries, yeah, globally. So, Dr. Saleh, is it possible? Can you just explain also the current situation of the COVID-19 pandemic in the Saudi Arabia and what has been done by the government in response to this COVID-19 pandemic?
First of all, Assalamu alaikum.
Salam wa rahmatullah.
And I'm sorry to join late, but I thought that we start at 1 p.m. Riyadh time. Maybe there was some misunderstanding. However, I'm so thankful to be with you today. And I don't know how much did I miss of this meeting, but in Saudi Arabia, actually, we are one of the countries that have got this exercise or this experience of COVID-19. But fortunately, the government here acted faster than many other countries. The hospitals were prepared. Teams traveled from Saudi Arabia to countries like China and Korea to understand how the pandemic spreads and what are the causes. When they came back, actually, they came back with the experience that they learned from such countries and started preparing for it. There were like lockdowns, as you may have heard, and homestay orders. Inhabitants, many of them, around 35 to 40% are expats, and the majority of these expats are laborers and low-skilled or unskilled laborers. So to educate these people about the dangers of the pandemic was a real difficulty. However, the numbers of the infected and the numbers of the deaths or the mortality out of is minimal compared to other countries, thank to Allah subhanahu wa ta'ala. And the government was in Saudi Arabia courageous in taking actions and decisions where they stopped Umrah, and they also have notified all countries that Hajj this year may be postponed. And actually, this is maybe one of the things that happened in the last maybe century or more. But there is a good excuse and justification because most of the people in Hajj are in big numbers and big groups, and this disease spreads faster amongst groups. Even mosques now, all of us, we pray in our houses, and there is nothing wrong with that. Our religion, alhamdulillah, is very tolerating performing your religious duties during such emergencies. The private sector also was very cooperative, and many of the hospitals, the private hospitals, and the lodges and hotels, they opened their doors for those coming from abroad, Saudis, or even non-Saudis that have like permanent working permits here in Saudi Arabia, and they keep them the 14 days, the incubation period, the doctors say, of the disease before they release them. And after they release them, they advise everybody to stay home, and we work from home. Strange to use the webinar or to use these softwares, because minutes before I joined, I was on another meeting. So it is making life a bit easier under such like lockdown, but it is for the benefit of everyone. I understood that you wanted to learn about the low class or the beneficiaries of Zakat families, the fragile. No, you hear me?
Yes,
The fragile class and the underprivileged families. Here, in Saudi Arabia, the state is in charge of the Zakat, collecting it and delivering it to the beneficiaries. In Saudi Arabia, we have about 800,000 households that receive Zakat, and they receive them in the form of cash deposited in their bank accounts. So they receive them monthly, and if like in such times the Zakat collected is lesser than what we collected in earlier years, the government makes up for the difference. So the recipients of these amounts, it's like social security. The recipients, they don't feel any reduction in their monthly received amount. And on top of that, the philanthropics and the philanthropic societies and associations, they work during these times as they collect food stuff from the donors from
Hello.
companies and deliver everything to these households. So people are not feeling like the difference, especially this class of people. They don't feel any difference than the regular times.
Okay, thank you very much for the explanation, Dr. Saleh. Now I would like to come back to Professor Bambang Sudibyo. Of course, as respond to this hardship and the difficult condition, many people, especially the poor people, are expecting the increasing role of the Zakat organization like BAZNAS. So, as respond to this situation, what has been done by BAZNAS, yeah, to respond to the situation and to help those who are in need, especially the poor and the needy. Professor Bambang? Professor Bambang, hello, can you hear me? Professor Bambang? Okay, while we are waiting for maybe there's some connection problem. Okay, so I'd like to ask Brother Azim first. You mentioned that uh, behind this COVID-19 pandemic, now many UK people are aware of the Islamic teaching like wudu, yeah, and also covering head, etc. So, in response to this situation, what role that has been played by UK National Zakat Fund in order to deal with this pandemic?
Thank you very much. So obviously we are maybe 1 month into the pandemic here. Officially 3 weeks the country has been in lockdown. Now, what we have focused our effort on is providing financial assistance uh, to the people. We established what we call like a 3-tier process, and I'll just talk you through each tier so you can understand. And so tier 1 was, first and foremost, we wanted to solidify and bring confidence to our team and the people that are working on the collection, calculation, distribution of zakat, that this is the most important time to show the value of zakat as a divine instrument. That this is not just ordinary charity, but this is the way that the Muslim community is able to build financial depth to serve society. So that was the first thing. The second thing was we were conscious that many people, because of the financial uncertainty, because of the loss of jobs, because of the inability to trade, will be increasingly scared and increasingly reluctant to give their money. So we didn't do any fundraising. What we did was we dedicated our effort and attention to providing support to payers in better understanding the zakat. So, for example, one of the things that is truly amazing, and this shows Allah's mercy on His people, and also His divine wisdom of the economy. So, zakat is obviously the sum that is extracted from your net wealth on what you have held for the previous 12 months. Now, what this guarantees and what this ensures is that despite any of the, let's say, immediate shock and despite any of the immediate difficulties and the uncertainty which may mentally stop you participating, you will have a bill, you will have your zakat bill, which is a reflection of your net position. So we were reminding our payers that, look, this is not charity, this is about money. This is about your worship and just understanding your responsibility. Again, no fundraising. And then the third part, we actually enhanced our direct access to masakin. So we very much targeted looking at those people that were, let's say, before the crisis, they were able to work, they were still surviving. But actually, this crisis will move many masakin into the status of fuqara, yeah, simply because the difficult trading conditions. So we decided to really increase our effort to reach those people that are in, let's say the most vulnerable financial status. So we improved access to the website, we improved access to communications, reduced our waiting time. So I don't know how it works in different Zakat authorities, but in ours, you make an application. The application is then assessed, and then a financial reward is made. We streamlined this process so we could optimize the number of applications that we can deal with in any one time. And we really focused hard to ensure that those people that are in distress and those people that are in difficulty, that their needs are immediately assessed and are immediately responded to. And this has had a very positive effect on the whole charitable community, first and foremost, because they have seen that even though we are a charitable institution, we haven't asked for money. We've actually said, for those people in trouble, just come and get money. This has had a positive effect. And then in wider society, they are seeing that actually, while many of the organizations are trying to raise money, this sovereign national Zakat foundation is only busy in giving money. And they have a strong confidence that actually the Muslim community will respond. They're not even asking. So we've been able to really focus on the needs of mainly the Masakin and the Fuqara to make sure that they are prioritized, and actually at a wider societal level, that's been really well received. That okay, this makes a very different perspective on Zakat. This actually shows this is more of an Islamic social finance as opposed to an Islamic charity only. So that's been my experience so far.
Okay, thank you. It's very interesting condition that you have explained. Now, Alhamdulillah, Professor Bambang is here again, and then I will continue to Professor Bambang. So, what is the role of the BAZNAS in dealing with this COVID-19 pandemic?
Yeah. Sorry for the connection was out because around my house there are severe rain and also very severe thunderstorms. Yeah, that may connection out because of that. Yeah. Well, with regard to BAZNAS, yeah, Alhamdulillah, due to the coronavirus pandemic, yeah, the collection of zakat, infaks, and other sedekah, yeah, and other religious fund, yeah, including CSR, because we also manage CSR, is increasing significantly, so that we can help a lot, yeah, those who have become the victim, yeah, economic victim, or even also the health victim of the coronavirus pandemic. Yeah. So, for example, yeah, we distribute, yeah, a package, yeah, packages of daily needs, yeah, for the poor people, yeah. Yeah, sometimes including the non-Muslim, yeah, even the non-Muslim, yeah, in case of because during the musibah namanya, during the
crisis or tragedy,
yeah, tragedy, yeah, crisis, yeah, then we can also provide some for the non-Muslim, yeah, to also help them, yeah, because in the case of tragedy, it is sometimes it is not ethical, yeah, to help people by asking first, are you Muslim or not, you know. For example, in the case of giving, the what is it, the for the what is the APD itu apa ya Pak? Medical
protection
ya, medical protection devices, ya, for the those who are positively infected, ya. So we can, some of them are also provided for the non-Muslim.
Yes.
And then we also provided, distribute a lot of mask, and also the protection devices, for the doctors, for the nurses, and also for the patient, and we also give some jobs, for those who are significantly their job, their volume of job, significantly reduced because of the crisis. We give them some jobs, and give them money for them, and by making them helping us in distributing help for those who are needing the BAZNAS help. And still many other programs that we are conducting, to help the victims, of the uh, of the uh, of the pandemic,
Okay.
either that economic victim or the health victim, of the pandemic.
Okay. Thank you very much, Professor Bambang. To Dr. Saleh, we have a question from the audience related with the issue of oil crisis, and most probably there will be no Hajj this year. So how do you think how is the Saudi government role to counter this issue? And also, how is the role of the uh, Zakat institution in Saudi in helping the government to deal with especially the victims of the COVID-19 pandemic?
Yes, well, let's start with the oil and the oil prices, because actually there was like a double dip, as we say, or maybe double whammy. The demand was heading down, and the prices were also going down because of the oversupply in the market. And this started like 5-6 weeks ago, when Russia broke up with the OPEC. We had the meeting of OPEC Plus, where Russia was managing the supply in the market in order to maintain prices. But suddenly, at the end of that earlier agreement, Russia decided not to continue with the agreement. So OPEC were free from such a commitment, and then the prices continued heading or nosediving fast, and it was not in the favor of any of the oil producers and exporters, including the North American oil companies. So everybody felt the damage, especially with low demand. So there was a trial or a try call between His Majesty the Custodian of the Two Holy Mosques and both the presidents of the United States and Russia. And then they went and put things back on the track, and the negotiations started again. And luckily, they reached to some agreement where there will be a reduction in the supply in the market that matches also the low demand in the market, especially with many of the businesses are lowering their speeds and reducing their production. And yesterday or the day before, they reached to an agreement. Countries even outside of OPEC from South America and other parts of the world. They joined, and fortunately, they have reached or almost reached to an agreement to reduce more than 10 million barrels a day. So this supposed to get the prices back in the maybe in the 40 range, $40 per barrel a day, per barrel, $40, and this is like on Brent index. I don't know about other WTI and other indexes, but it's in the same range. So this is going to make up for any like damages caused by COVID-19 to some extent. Saudi Arabia has good investments abroad, and we have good reserves. So for like hopefully this does not last for a long time, but we do have a good reserve, and recently, like a week or even less ago, most of the rating agencies gave Saudi Arabia the best rating ever received. So this is another indicator that we have a solid economy. For the Hajj, and just to follow up on the solid economy, we are also taking care here locally of the expats that are even violators of the residency laws, and this was by the order of the royal court that they should be treated even if they are violators, because this is a pandemic, and this is a disease that, as His Excellency Dr. Bambang say, the disease does not discriminate between Muslim and non-Muslim. So even non-Muslims, everybody here on the soil of Saudi Arabia is receiving the same good treatment for their health needs. Hajj and Umrah, and I have said this earlier, but maybe briefly, Hajj this year, at least what we can envisage at this point in time is wouldn't be possible, especially with 3-4 million people come in a very small area where God, Allah subhanahu wa ta'ala forbids if things go wrong with one person, and this is a very contagious disease, infectious, and it can infect millions of people. And you know, if these people are in the same place, Mecca and Saudi Arabia as a whole cannot, the health system cannot take care of such big numbers. Allah forbids that this happens. So and alhamdulillah, al-hajju liman istata'a ilayhi sabila, and this is one of the pillars of Islam. Hajj is for those who can make it. So if you cannot make it, then Allah subhanahu wa ta'ala forgives us, and it can be done on a later year. Therefore, Saudi discussed this with many of the representatives, the ambassadors of the Islamic countries here in Saudi Arabia, as it was mentioned here in the media, to notify their respective countries that Hajj may be postponed this year, and those who were like registering from their respective countries to come to Hajj, they need to be notified that they may not be able to perform Hajj unless things develop positively before that time, enough time before Hajj, which I personally doubt it. I doubt that we can have Hajj this year. Maybe the Sha'ira of Hajj or Hajj as can be performed by like hundreds of people just to perform Hajj and make the Sha'ira applied and obvious that Hajj is made. But I personally, I wouldn't encourage that Hajj be conducted or this year as it is done every year. For the safety of the people and their health and their safety in Islam is a priority.
Okay, thank you. And we have another question from the audience directed to Brother Azim Kidwai regarding the zakat recipients. Yeah, because of course you are living in the Muslim minority countries, and the number of the non-Muslims affected or infected by this virus is also very big. And how do you ensure the alignment of the zakat rules and also its distribution towards the victim of the COVID-19?
Yeah, a very, very good question. So one of the advantages of being a dedicated agency for zakat is that we operate a restricted fund. So our funds that we collect as zakat, by law, they're restricted for zakat purposes only. Now, in British law anyway, the way that you collect funds restricts legally how you may distribute them. So we've never really had a problem in this issue about distributing zakat only to Muslims, because we've legally, that's what we are intended to do. But in terms of managing that message, what we've always tried to do, alhamdulillah, is to make an effort to have strategic engagement with the government, with other major charities, so that if somebody comes to us and they are not eligible for zakat, then what we try and do is provide either some assistance through non-zakat, or we make sure that we introduce them to a partner agency that is willing to provide them with unrestricted funds. So, for example, right now there are many hardship funds that have emerged for the general people. So we are trying to use zakat funds for the Muslim people and also provide access to and signposting to non-zakat funds for non-Muslim people. One of the key things that we've always maintained as well is now marketing is that when it comes to the identification of potential recipients, we use very strategic online marketing methods and community marketing, so that the vast majority of people that will understand that zakat funds are available are Muslim. But I can say that we have very few situations where non-Muslims have applied, and even when that is the case, because we have a policy of not turning anybody away, we always find a partner or a fellow agency who understand the reality of managing restricted funds to provide that support. I can give you an example of the city that I live in. So I live in a city which is called Bradford. It's one of the most populous Muslim cities. Maybe 23 or 24% of the city is Muslim. Yeah, it's a big Muslim city. So what we have done here is proactively we engage the local government to say how can we help, and we've worked with them to provide resource to those people that are in need. So, for example, here one of the things that we have, which we're usually seeing in, unfortunately, in Asia and Africa, is the distribution of food boxes. So it will be like a ration box with rice, oil, flour, etc. Things that we take for granted. So we have worked with the central government to make sure that anybody that needs this, that we can work together to deliver. So, for example, in my city, the government identified 16,000 vulnerable people, and they engaged us to work side by side with them to make sure that these people's needs could be met. So, alhamdulillah, we've not had an issue so far of having to discriminate or having to have a restriction of funds for Muslims and non-Muslims, alhamdulillah. But I think it's because proactively we've always tried to engage the government and other major partners to make sure that this is never a problem. And up till now, alhamdulillah, it's not a problem.
Okay, thank you, Brother Azim. So it proves that the role of the UK National Zakat Foundation and also the Muslim society is very important, and it's a momentum for the Muslims to show the true teaching of Islam to the others. Okay, I will come to the next question from the audience. I think this is directed to Professor Bambang from Sister Yasmina, the CEO of the South African National Zakat Fund. How are you, Sister Yasmina? She raised the question of may reduce the ability of the Muzaki to pay zakat. So how do you anticipate this situation, especially when it comes to the issue of zakat collection?
Yeah. If we think in terms of economics, yeah, the zakat potency is very highly related to the the size of the GDP. When the size of the GDP is down, then the zakat collection is down. But that is not always the case for zakat. Sometimes at the time of disaster, it's the other way around. Yeah. When the GDP is down, it's the zakat collection is increasing because of the people, because of the Muzaki generosity, is improving because of that. Many Muzaki think that that is a very good time for them, to pay zakat and also the non-zakat fund, infak, sodako, and other non-zakat donation. And in the case of BAZNAS, during the Aceh tsunami, for example, in the case of the tsunami, the collection of the growth of zakat collection in Indonesia is almost 100%. 100% growth at the year of the tsunami. The next year, the tsunami was in December 2004. The growth of zakat collection, in the next year, in 2006, was almost 100%. So it could be, that even though the many companies, many people are experience decreasing income, but they pay more zakat and other Islamic donation. That was the case in Indonesian experience in the past. So we don't. Yes, of course we make a the what we call the non-prospective projection, but we also make a the prospective projection. It could be that zakat and other Islamic fund collection this year is gonna be bigger than last year. And that's what we do hope.
Okay. So it means that we are expecting, although the economy is affected badly with the COVID-19, but it is not always the case with the zakat. It may increase, and Professor Bambang has stated that Indonesia is expecting the number of zakat is increased and bigger than last year. Another question from the audience for Professor Bambang is related with the collaboration. How do you manage the collaboration among the zakat institutions in Indonesia? Because Indonesia has BAZNAS and also other private zakat institutions. So how you manage these institutions to collaborate and in response to this COVID-19 pandemic?
The collaboration is working quite well. We manage the collaboration, using using IT based coordination with BAZNAS is supposed to be the coordinator of all zakat organization management. All zakat institution in Indonesia is coordinated by BAZNAS. We do the coordination, just like what we do now. We do teleconference, we do communications, even we because of this pandemic, we find some new ways, to do things better. to do things more efficiently, yeah, and to do things easier, yeah. For example, the digital zakat collection, yeah, is increasing very significantly because of this pandemic. Yeah.
Okay. Thank you, Professor Bambang. It's a very interesting discussion this afternoon in Indonesia and daytime in Saudi, and also still in the morning in the United Kingdom. So we have 3 different time zones here. And unfortunately, the time is limiting us, but I still have a chance to ask each the panelists to the same question is, what do you think, what should be the role of the World Zakat Forum and the global action that needs to be taken by global zakat institutions? I will start from Brother Azim. Do you have any suggestion, and how do we collaborate and increase the cooperation during this hardship? Yeah, Brother Azim.
Yeah.
Yes.
Jazakallah khair. Firstly, I would say, the wonderful, let's say, vision and spirit that World Zakat Forum has, is to carry on with that, because mashallah, you guys have a wonderful ability to bring people together and to inspire people to collaborate. So, firstly, thank you on behalf of other members, but I think this is the first thing that should continue. More specifically, I feel that there's 2 major areas of contribution that we should try and achieve. Number one is that we should encourage members to document and provide clarity of what they're doing to you as a central resource for World Zakat Forum to be able to evidence this for the history books, that what Islam and Muslims and Zakat wealth was able to do at the time of the crisis. It's often said that history is in the hands of who writes it. And I feel that it will be very easy to ignore the Muslim contribution to the response to a successful and a less dangerous resolution to what Corona has brought. MashaAllah, Sheikh Saleh, he mentioned earlier about the swift response of Saudi Arabia. Professor Bambang mentioned so many measures that were taken by the government of Indonesia. These are things that shouldn't be underestimated, and they should be catalogued. And the Zakat authorities, any good that they have done, should all be brought together. So let's say, inshallah, in years to come, there would be, and people would talk about COVID-19 and Corona in 2020. It would be wonderful if World Zakat Forum had, a book or a chronicle that catalogued all the contributions from Saudi Arabia, from the UK, from New Zealand, from Australia, all these different places, mashallah, where Zakat authorities are working day and night and providing support to Muslims and non-Muslims. Like Professor Bambang mentioned, alhamdulillah, this is from, I think, the great leadership of yourselves and others, where we've not said, no, this money is not for you and this money is not for you. We've worked tirelessly to make sure that we fulfill the rights of Zakat, but also find solutions where there are some difficulties. So this is the first thing. The second thing is, in terms of better coordination, I think the process by which this first one is achieved will normalize that, will make that easier. So if, for example, there is a request for an update from each country on what they're doing, as those updates come to you, if you can start sharing them, then I think that will naturally improve coordination and learning, because people can then share intelligence. So if we see some really good practice that's going on in Indonesia, and there's a similar context, say in Pakistan, then those guys can learn from that. Yeah, because maybe on the website you would say, this new program has been announced, or this practice has been achieved these results, then this will be something positive. And I think Sheikh Saleh's point earlier is very important to reflect on, that and I don't think this is by chance, but the impact of Corona and the numbers in the lands where Muslim countries are, Muslim governments are operating, they just seem to be a lot smaller than in non-Muslim countries. Yeah, I'm not saying that's coincidence or that's something bigger than that, but it's a fact. Yeah, so Professor Bambang said earlier that Indonesia has 300 deaths, and you are much closer to the center of this virus in China than we are. We have 10,000. Yeah, and we are a country 20% of your size. Yeah, America is now the world center of both contraction and death, and it's the furthest away from everyone. Yeah, So there is something about we should be proud of this, that we have taken extra measures. We have shown great leadership, be it in Saudi Arabia, be it Indonesia, be it Malaysia, and we should be proud of that. But not in a way that is boastful, but just that we are confident we took good measures, and that history should record this, that Muslims were very responsible, and their institutions showed more mercy than any other institution. And I request take some leadership role in asking us to provide data, and our job is to give you that data with due respect, and then inshallah for you to share that.
Thank you very much, Brother Azim. Dr. Saleh, any comment?
Wallahi, I don't have more to add to what Brother Azim said. But I just want to reiterate that being proactive is an excellent strategy. We've started earlier, and I don't think that the disease discriminates between people from different parts of the world or different faiths, but maybe we have some good customs and things related to our security and that has also helped. And this is an excellent time to show people all over the world the beauty of Islam and the beauty of the teachings of Islam. It's an excellent chance, and we all Muslims are callers for this noble religion with all the practices that it calls for. We have a chance here in Saudi Arabia, actually, because this year we are the leaders of the G20, and His Majesty, the custodian of the two holy mosques, have called all countries all over the world, the countries that represent about 90% change experiences regarding finding the cure to it.
Okay. Dr. Saleh?
Not to in such crisis, we have to watch for the well-being of the humanity, and not to the wealth or the money or that we can get or collect out of such a crisis. These are very important messages that we send from Saudi Arabia, the center of the Islamic world. And every Muslim everywhere, in every part of the world, has to show the people the importance of caring about their families, their health first, and their families and their neighbors, regardless of their faith. This is an excellent, as I see it, is an excellent chance. It's an opportunity for us to spread, to counter-spread COVID-19 by spreading the teachings of Islam and the beauty of it.
Okay, thank you very much, Dr. Saleh. And Professor Bambang, as the Secretary General of the World Zakat Forum, what would you like to do to accommodate and to respond on the messages that have been shared by Brother Azim and also Dr. Saleh? What should be the role of the World Zakat Forum?
Yeah, we have not decided yet about when and where we are going to conduct the World Zakat Forum conference and annual meeting that were supposed to be conducted in Malaysia, in Selangor, Malaysia. But they turned down their commitment, so that we still have, we are still waiting, for the best time and venue, for the next meeting, But for sure, the next year, 2021, the World Zakat Forum conference and annual meeting will be conducted in London. You still remember, brother
Azim.
Kidwai? Yeah, it's gonna be
I'm
in London.
counting the days. I'm counting the days.
Okay. Yeah, of course. Yeah, this COVID-19 pandemic should be reflected. Yeah, in our resolution. Yeah, in the next resolution, the resolution this year meeting, yeah, and also the in next year's meeting, because this is very very severe experience, yeah, that of concern of everybody and of every zakat institution in the world. Yeah, so we should be prepared, yeah, to reflect that in our World Zakat Forum resolution, yeah,
Okay.
in the next two meetings, yeah.
Okay. Thank you very much, Professor Bambang. I know that there are a lot of things need to be discussed, but unfortunately the time limits us. But inshallah, for the audience, every Monday afternoon, Indonesian time, we are going to conduct the series of the World Zakat Forum International Webinar discussion that will also present various distinguished speakers, experts, regulators from all over the world. So hopefully this can be the moment for us to share each other and to utilize this technology to interact in a better way and in a deeper way. So once again, thank you very much to Brother Azim Kidwai, to Dr. Saleh Alawaji, and also to Professor Bambang Sudibyo. May Allah bless us, and hopefully the COVID-19 pandemic can end in hopefully as soon as possible. We pray Allah so that it happens. Very much once again, and let us recite Alhamdulillah, Alhamdulillah Alamin. By that, I end with Salam. Assalamualaikum warahmatullahi wabarakatuh. And a
Waalaikumsalam.
good afternoon.
Gimana, Dad, ini anunya?
Okay, thank you.